Hi everyone, this is Aurelie Najm from Glasgow, live from Copenhagen for day 3 of EULAR. I have had an amazing day. So many nice presentations that I'm dying to share with you. One of them was specifically of interest to me and might also be of interest to you, as this is a question for which I did not have any answer up to now. We know that in rheumatoid arthritis, there have been quite a lot of studies looking into tapering TNF inhibitors in patients that are in remission. However, there was absolutely no data on PsA or AxSpA patients. This is why today OP061 kind of answered my questions. So it's been a randomized clinical trial, open label, where they have actually included patients that have PsA or AxSpA. They were randomized 2-to-1. And they had to be in low disease activity for more than 6 months. So they have a sustained remission. So the way they've been randomized and the way it's been tapered down was for those in the tapering group, 66%, then 50%, and then stop over the course of a few months. So quite a rapid tapering down. And the low disease activity was considered if the PsA was inferior to 3.2 or if the ASDAS was inferior to 2.1 in the AxSpA population. So there were not a lot of patients, only 81 in the tapering group and 41 is the non-tapering, and they were reparsed approximately half PsA and half AxSpA. So through the 3 monthly tapering, they looked at 1 year, the proportion of patients that were still in remission. And in both group, it was a non-inferiority trial, by the way. In both group, roughly around 70% of patients were still in remission at 12 months. So there was no difference in terms of remission. However, there's something that, make me wonder when it comes to those patients that were tapered down, for whom there was a need to introduce concomitant medication. So if you look into this specifically, there were at least 1/3 of the patient that required glucocorticoids in the tapering group, as opposed to 17% in the non-tapering group. It was not significant, but again, the numbers were low. However, for NSAIDs, there was a significant increase, with half of the patients in the tapering group that needed increase in NSAIDs dosage compared to the other one. So I think it's quite interesting data. Now the question is, would you actually decide to taper down in a patient if you know that there's 1 chance out of 3 that you will need to give them glucocorticoids over the course of the year? This is something, I guess maybe the other thing that is needed would be to probably define better the tapering strategy, and obviously try and find biomarkers to know what patients are going to remain in sustained remission while tapering. And those questions, we still don't have the answers yet. But I think it's a good trial, and it's something to start with, at least in this area. So I'm gonna stop here. I invite you to go online on RumNow.com for more content. Follow me on Twitter, follow RumNow, and stay tuned for the last day of the conference tomorrow. Bye.